Good evening and welcome to Chicago Tonight, Latino Voices. I'm Joanna Hernandez. On the show tonight, state officials send more money to Chicago to help care for migrants. Why Cicero's air quality is proving to be much worse than its neighbors. A look at the impact. How a bill going through Springfield could help non-English speakers access government services.
More vegan businesses are going to open up. This is the future.
And plant-based eating is on the rise. Find out what local Mexican restaurants are bringing to the table for vegans. And now to some of today's top stories. 24 people are recovering tonight after a train collision earlier today. The crash happened in Rogers Park, north of the Howard Street CTA station, causing several delays on the yellow, purple, and red lines. Fire officials say the train collided with a piece of equipment. 23 people were taken to the hospital, 3 with serious injuries.
We've turned it back over to the CTA. They've restored power back to the station. We were working well north of the station, about 300 yards. So they have a big investigation to do. Our OFI has to come in and take pictures. We have the police going in there to do an investigation as well. Then CTA has to figure out what they're going to do with all this equipment.
The incident appears to be the most significant CTA derailment since 2014. Now, Chicago is set to get more money from the state to care for migrants as winter approaches. Governor J.B. Pritzker announces the state will spend an additional $160 million to assist the city. Pritzker's plan includes assembling teams to help the city provide shelter and other services to the more than 20,000 asylum seekers. A portion of the money will go towards creating a welcome center where a team will oversee arrivals. Pritzker says the move will help speed up the process.
The state is also funding a New Life team to deploy to the bus landing zone to ensure every new arrival is supported in a choice to seek alternate arrangements outside the city shelter system. With this approach, we anticipate reducing the number of people who need shelter by approximately 10%.
Funeral arrangements are announced for Chicago firefighter Andrew Price. 39-year-old Price was killed Monday after falling through the roof of a Lincoln Park building while battling a fire. The funeral service is set to take place Monday at the Navy Pier Grand Ballroom. A private visitation will begin at 9 a.m. with a public service at noon. Opening statements begin in the corruption trial of former Alderman Ed Burke. It comes as jury selection finished today after a week-long delay because an attorney contracted COVID. 9 women and 3 men will serve on the jury. Burke faces 14 charges of racketeering, bribery, and extortion. There's more on today's opening statements on our website. Up next, we explore pollution concerns in a western suburb. That's right after this.
Chicago Tonight, Latino Voices, is made possible in part by the support of these donors.
A year-long investigation reveals Chicago's air quality is much worse than its surrounding Cook County's neighbors. Cicero's, the project involves sensors installed and monitored by Cicero's Independiente and Muck Rock, providing data to back up what many community members were already feeling. West suburban Cicero is a largely immigrant community, and over 80% of the population is Latino. Joining us now to discuss these findings are Irene Romulo, Development and Community Engagement Coordinator with Cicero Independiente, and Marina Koklak, a health geographer at the University of Illinois Urbana-Champaign. Thank you both for joining us. Irene, I want to start with you. Why did you decide to take this investigation into your own hands as a newsroom?
Yeah, well, it's very common in Cicero to hear complaints of people that say that the air feels weird. Often people complaining that there's a rotten egg smell in the air that comes from the water reclamation plant, or sometimes feeling like there's haziness. So we know that there's been studies conducted in the city of Chicago to measure the air quality, and we wanted to find out more about what's actually happening in Cicero. So we enlisted the help of different volunteers, residents in Cicero, who said, like, hey, this is something that I care about. You know, let me host one of the air monitors so that we can actually learn about what is going on in our town.
And Irene, as the investigation pointed out, Cicero rarely exceeds federal Clean Air Act standards for air quality. What results did your sensors show?
Our sensors show that, our sensors are measuring PM 2.5 or soot daily, like every 2 minutes. And there's already sensors in the area that measure that same particulate matter every 6 days. But our sensors show that, compared to other communities, Cicero has some of the worst air quality, including industrial zones like Little Village. Over the summer, we saw days where that particulate matter spiked, including on days when, yes, there were wildfires happening that affected everybody in the nation, but it was particularly worse in Cicero. And this is happening in, areas where people are living and breathing in every day the emissions that come from, pollutants like large trucks and the different industrial corridors where people are living and where our schools are located.
Of course, Marina, I want to go to you. What impact can this have on people's health over time?
So both short-term and long-term exposure can influence a range of health outcomes, from things like increasing visits to the ER for an inflamed asthma aggravated incidence, but also this can lead to long-term chronic health conditions, from asthma to changes in cardiovascular disease and that sort of thing. But also, even if you don't have to be right next to a plant to experience some of these challenges. If you're living with chronic stress, which many of the residents in Cicero are living through because of excess economic hardship and many other factors, there's kind of an extra challenge to health outcomes because your health can only take so much at a time.
Yeah. Irene, I want to go back to you. How is this air affecting the families you spoke to?
Well, some of the families that we spoke to, for example, there was JJ, the son of Natalie and Javier Solis, who talked to us about how he was diagnosed with asthma as an infant. And there are several days, especially on the days where, we see a relatively high reading of PM 2.5, where he's actually experiencing trouble breathing, and his parents have had to take him to the hospital, have had to take him to the doctor. So it's those sort of recurring stories that we heard throughout, our research, because we weren't just measuring the air quality. Some of the work that we've done is actually door knock, talk to residents to hear more about their own health concerns. And during the summer especially, we heard a lot of people telling us, that they experience headaches or that they experience sore throats, especially on the days.
You started hearing a pattern.
Yes, especially on the days when we noticed that there were spikes in the particulate matter readings.
And Marina, going to you, Cicero has a long history with polluters. As the investigation pointed out, what factors contribute most to the poor air quality?
Well, it's definitely a complex pattern. So in addition to emissions by different emitters, as you've talked about, there's also the physical environment. So sometimes just where places are situated can create this kind of compounding challenge. So Cicero is located between two massive highway structures and also just north of Midway, right? And there's also a lot of different issues in the physical environment that just add additional challenges. I
want to ask, how would you say that Cicero's air quality compares to other parts of Chicago?
Yes, so compared to other parts of Chicago, you're looking at some of the highest rates of reported particulate matter, and that's across multiple different models. That's across the model that our team ran at UChicago. It's also in line with some partners at Northwestern and what they found. When you're looking across the entire country on the city health dashboard that New York manages, you're looking at the highest, some of the highest rates in the country when you're across other cities as well.
And Irene, was it disappointing to you to just see how the air quality was so much different than in other neighborhoods compared to Cicero's air quality?
It's actually something that, we kind of guessed was happening, but it was really daunting to look at the data and to have those readings. And I think what's important too is that this is an opportunity for our town government and local elected officials to really listen and pay attention to what is happening and create opportunities for people to become involved in deciding really the future of our town and how we can address not just this issue, but other environmental concerns that we're facing.
And what can people do about the poor equality in their community?
This is actually a section in our report where we talk about both the individual actions that one can take and some of the different policies and things that other communities are trying. For example, we talk about people like understanding these readings and making sure that local agencies are communicating to people in the language that they understand when there's bad air quality.
Did you see people who, when you were door knocking, that they just lacked awareness? They just didn't know?
Yes, definitely. We saw people who showed us the alerts that they got on their phone, but they didn't know what it meant because it was in English, and therefore they didn't know that, maybe I should limit my time outside, or I should consider wearing a KN95 mask when I'm outside. But I think what's important too is some of the institutional and government actions that can be taken. Like for example, there's communities who are actively doing pollution emissions, putting caps on emissions, making sure that they're doing environmental studies and allowing for its citizens to really become involved in the decision making and decide, well, what is more important? Is it the industry that's polluting our environment, or is it some other things that we need to pursue?
Well, thank you so much. That's all we have, but thank you for sharing your investigation. Our thanks to Irene Romolo and Marina Koklak. Up next, help may be on the way for non-English speakers accessing government services. Stay with us. There are many different languages spoken in Illinois. According to Cook County data, 35% of residents speak a language other than English at home, while 14% of those people say they speak English less than very well. Meanwhile, as migrants continue to arrive in Chicago with little to no English speaking skills, they face limited resources to help them navigate their new circumstances. Now, a bill going through Springfield aims to eliminate the language barrier when accessing government services. Joining us now with more are Grace Pai, the Executive Director of Asian Americans Advancing Justice Chicago, and State Representative Dagmara Avilar, whose district includes part of the southwest suburbs. Thank you both for joining us. Now, Representative Avilar, I want to go with you. Can you start by telling us, how is this bill different from the current language services Chicagoans are familiar with?
Yeah, thank you so much for having me here today. To your question, I think what we're trying to do here is we're trying to find an approach that serves each of our limited English proficient populations, not just beyond Chicago, but in the Chicago suburbs as well as central and downstate Illinois. So what we're truly trying to do with HB 3222 is to be able to have a language access policy that actually fits the needs of our community here in Illinois.
And where would you say the government agencies are currently lacking?
Yeah, what I would say, and I could tell you from my experience, not just working as a state legislator, but previous to that, as the director of programs at the Illinois Coalition for Immigrant and Refugee Rights, the organization has now what is a 20-year program called the Immigrant Family Resource Program that's specifically to address barriers to access to not just access to state agencies when it comes to language, but then also other barriers that has to do with cultural competency. So throughout the 20 years that this program has been in place, we have seen that time and time again, while we may have some state agencies that do have wonderful language access programs, there are other state agencies that are lacking on their language access program when it comes to training, as well as hiring people beyond the Spanish language to be able to interact with limited English proficient individuals.
And Grace, talking about that, if someone can't get language assistance, how are families left to navigate government services, would you say?
Well, unfortunately, we've heard many stories from community members who have had to provide translation or interpretation for their families when they're kids. A lot of immigrant families have that experience, right, of having to ask their kids to translate for them at the grocery store, at the doctor's office, places where it's not appropriate for a child to have to play that role. We really hope that when somebody needs to seek state services, that they're able to do so with a professional interpreter, someone whose job it is to help them access those services so that the burden isn't falling on family members or friends who are often doing that for multiple families.
And you just said something I was about to ask. You do see this easing the burden?
Absolutely. Right now, a lot of community-based organizations like the Illinois Coalition for Immigrant and Refugee Rights, which Representative Avilar mentioned, have to fill the gap. Right? And there are certain state agencies that are doing a good job, but we want all state agencies to do a good job and to have a plan. I think that's the most important piece, is that right now some state agencies don't have a strong plan in terms of providing language access, and we know that the need is huge.
So you would just say almost scrambling to find this need,
Absolutely.
this service.
Right. And there are a lot of amazing community organizations that are filling the gap, especially for language groups that are not as commonly spoken, but really we want that to be the responsibility of government.
And Representative Avilar, you are an immigrant yourself and now a U.S. citizen. Can you speak about how difficult it can be to navigate these services without the right support?
Absolutely. You know, as Grace was talking about the role that sometimes immigrant children get to play in their parents' life here in the U.S., as Grace was talking about becoming our parents' translators, I remember at the age of 15 being my mother's translator for an administrative hearing with the Secretary of State, and just thinking about this happening in the early 2000s, and knowing that at this point, in the moment that we live in 2023, that we still have people who are acting as their translators when we might not be qualified to interpret in a medical setting and an immigration setting, let alone an administrative hearing with the Secretary of State office. So, you know, as somebody who acted and continues to act as my parents' translator to help them navigate the process, I think that this is not just about language access, but about building trust with our state agencies and with our community members living in Illinois.
I mean, I remember I was young as 9 translating for my parents at doctor appointments. Now, Grace, going to you, there are many different communities that could be impacted by this legislation. How many different groups can come together to advocate for language equity?
We have built a multiracial, multi-ethnic coalition because we know that there are so many people who are impacted by language access. A lot of people assume it's just the Latino community that needs language access, but there are so many language groups that are left out of the current language access that people receive. So I represent the Asian American community, work in the Asian American community where there are dozens of languages spoken. We've also partnered with African immigrant communities, right, who represent other language groups, Arab American communities. There's so much need out there. Languages like Vietnamese, Korean, Tagalog are not always kind of counted in the top 5.
And I also want to ask, your organization just spent a day in Springfield advocating for the bill. How did that go?
It was excellent. You know, I think this is an issue that motivates a lot of people because they're personally impacted by it. So we had a number of community-based leaders who traveled to Springfield, who met with their legislators. We were able to secure 8 new co-sponsor commitments. So we're really excited to bring that energy and momentum back to Springfield in January.
And Representative Avilar, we only have a couple seconds left, but what happens from now until then?
What happens from now until then is continue to advocate. We are encouraging not just organizations, but community members to continue to contact their state representative as well as their state senator to let them know how important it is to make sure that this bill becomes a law.
So we actually have time for one more question. What would you say, you know, that people really need to know about this? People who've been waiting for this service.
Absolutely. You know, language access is a right. We should live in a multilingual society. English is not, you know, the official language of the United States. We are a nation made up of so many different vibrant and diverse communities, and really we owe it to all of our immigrant neighbors, whether they just arrived in Chicago or whether they've been here for generations, that this is a welcoming and inclusive place for them.
Well, thank you both for this informational conversation. Our thanks to Grace Pai and State Representative Dagmara Avilar. Up next, a taste of Chicago's growing vegan taco scene. But first, a look at the weather. When it comes to tacos, the first thing on people's minds is what kind of meat is going to be inside that torta. But these days, about 20% of Mexicans identify as vegan or vegetarian, and a growing share of America's Latinos do as well. Producer Erica Gunderson stopped in at 2 Northside spots who are taking their tacos in a plant-based direction.
The concept of veganism is way off, especially from my experience coming from a Mexican family. Like, even my family don't get it.
For many Mexican Americans, the idea of Mexican food without meat can be a little hard to grasp.
Growing up in a Mexican family, meat is like the thing, no?
But as the owner and chef behind Penelope's Vegan Taqueria points out, indigenous Mexican cuisine is rooted in plant-based foods.
When the Aztecs were around, when the Mayas were around, before La Conquista, think about it, like their menu, their cuisine was, I think, 90% vegan, vegetarian. Some of the recipes that we have are passed along in my family, So it's easy for me to say, I'm gonna do a black beans, frijoles de la olla, Okay, I remember how my mom did it and how it smells, so I'm trying to recreate that. Now with the torta milanesa, I remember when I had it's breaded chicken. What can we do to replace the chicken?
Juan Lisandro Ramirez says becoming vegan was part of an awakening for him.
To have this lifestyle of being vegan is different things. It's not only health reasons, spiritual reasons. I used to drink a lot and use drugs, and then I lost everything. One day I woke up and said, you know what? Like, it's either I die like this or make a change. Right? I don't want to die young. From now on, I'm going to stop everything. Everything is going to kill me. After 6 months, I'm like, I feel great. It became my lifestyle.
Ramirez says when he made the switch, he had trouble finding places outside of home to eat. So he and his wife decided to do it themselves by selling vegan tacos in pop-ups. The Andersonville Penelope's is their second brick-and-mortar location. That same DIY spirit is what Carlos Luna and Bernice Vargas say inspired them to open their vegan taqueria, El Hongo Mágico, which offers tacos and tamales starring mushrooms. Luna says their endeavor began with a health scare.
I had been looking at losing 18 inches of colon for a few years, and so I was willing to try just about everything to avoid such an invasive procedure, and I was led to a plant-based diet. I was fortunate enough to have a partner like Bernice who said, all right, let's do this together. And we started cooking at home, and it was a trip to Mexico City where we fell in love with mushrooms. We came back home and started playing with them.
So I went back to what my mom would cook for us. I realized a lot of my favorites were plant-based: lentejas, calabacitas, tortas de papa, or just like potato cakes that you do during Holy Week. It's been easy to go back to those recipes and realize, lentejas, to go back to that example, something that my mom made. It's so simple, it's so delicious.
After a year in a ghost kitchen, El Hongo Mágico is now part of the entirely vegan X-Market food hall in the Uptown neighborhood.
It's a dedicated space for veganism, for plant-based.
They say they hope that increasing veganism visibility can show it's a tasty way to improve community health.
I am part of the veteran community, and I see a lot of veterans that I believe can suffer a lot less if they can minimize things like inflammation, right? If they can minimize things like weight. And I'm not going to say that a plant-based diet is going to fix all the health conditions that they may be fighting, but I will be willing to bet that a plant-based diet will help alleviate some of those symptoms. So when people try our food, I want them to feel the way that they feel when they eat Mexican food. They enjoy it.
Back at Penelope's, Ramirez says when it comes to vegan cuisine, taquerias like his are just the beginning.
I think people want to live longer. They want to live healthier lifestyles. I think in the future, more and more vegan businesses are going to open up. This is the future.
For Chicago Tonight, Latino Voices, this is Erica Gunderson.
I always say we should be open to new experiences, so if you haven't tried vegan food, why not give it a try? You'll find more details on Pilanapis and El Hongo Mágico on our website. And that's our show tonight. Be sure to check out our website, WTTW.com/news, for the very latest from WTTW News. And join us tomorrow night at 5:30 and 7 for the Weekend Review. And be sure to join me this Monday, November 20th at noon for our next Latino Voices community conversation. It's going to be a good one. We'll be discussing the legacy of AIDS advocates and political cartoonist Danny Sotomayor and the path he paved for the LGBTQ community. To RSVP, visit WTTW.com/events. Now, from all of us here at Chicago Tonight Latino Voices, I'm Joanna Hernandez. Stay healthy, stay safe. Buenas noches.
Closed captioning is made possible by Robert A. Clifford and Clifford Law Offices, a Chicago personal injury and wrongful death firm that is committed to supporting diversity, equity, and inclusion initiatives throughout the legal profession.